New Danish study refutes link between Tylenol use in pregnancy and autism. A large-scale study conducted in Denmark has found no evidence of a link between the use of acetaminophen, brand name Tylenol, during pregnancy and the subsequent diagnosis of autism in children. The findings, published in JAMA Pediatrics, provide a significant counterpoint to recent political and regulatory warnings that have altered medical behavior in the United States. The scale of the evidence, leveraging Denmark's comprehensive national healthcare registry, researchers were able to conduct an expansive analysis of over 1.5 million children born between 1997 and 2022. The study specifically tracked 31,098 children who were exposed to acetaminophen in utero. The data revealed the following autism diagnosis rates. Children exposed to Tylenol, 1.8% children not exposed to Tylenol. 3%, these figures suggest that rather than increasing risk, exposure to the medication was associated with a lower rate of diagnosis in this cohort. These results align with a 2024 Swedish study, which suggested that once sibling genetics are accounted for, any perceived link between the medication and autism disappears, reinforcing the scientific consensus that autism is primarily driven by genetic factors. The impact of public warnings, the study arrives at a critical moment of public health confusion. In late 2025, the U.S. Food and Drug Administration, FDA, announced plans to update acetaminophen labels to include warnings about potential autism links, a move bolstered by public statements from the Trump administration. The real-world impact of these warnings has been immediate and measurable. Emergency room usage. According to a study in The Lancet, orders for Tylenol for pregnant patients in emergency rooms dropped by 16% following the announcements. Rapid fluctuations. At the height of the news cycle, orders plummeted by as much as 20% within just 3 weeks. Targeted behavior. The decline was specific to pregnant women. Order rates for non-pregnant women of the same age and usage of other medications, such as opioids or IV fluids, remained unchanged. Health officials' words are affecting behavior, noted Jeremy Faust, an emergency physician at Mass General Brigham and a researcher at Harvard Medical School. Why this matters for maternal health. The shift in prescribing habits raises concerns among medical professionals regarding the management of pain and fever during pregnancy. Acetaminophen remains one of the few widely accepted options for pregnant patients because other common pain relievers, such as ibuprofen, Advil/Motrin, or naproxen, Alev, carry risks of placental issues and bleeding. The danger of avoiding Tylenol is twofold. Unmanaged pain. Pain itself can be a physiological stressor for the pregnant person. Fever management. High fevers during pregnancy can pose their own set of risks to fetal development. While researchers noted that doctors did not pivot to using opioids, which carry their own set of significant risks. To fill the gap, the sudden avoidance of the safest option creates a vacuum in standard maternal care. Conclusion: the Danish study provides robust evidence that acetaminophen does not increase autism risk, suggesting that recent declines in its use during pregnancy are driven by public perception rather than clinical necessity. This highlights a growing tension between regulatory warnings and the practical needs of maternal pain management.